So an abdominoplasty is going to be, patients will have some pain and some tightness because when you're doing an abdominoplasty, about 80-90% of the patients, you're tightening up the separation of the muscle either from weight gain and then weight loss or from pregnancy. It's called diastasis recti, and so you have to put sutures all the way down the abdomen to tighten that up. Now that's where patients have a lot of discomfort. Now what I do is during surgery, I do numb up some of the internal nerves to help with post-op pain. My patients actually recover very well because of that. But usually I tell patients, if you have a demanding job, you want to take at least anywhere from 1 to 2 weeks off because there will be drains placed, and the drains are removed anywhere from 7 to 14 days. And that's one thing that makes patients really uncomfortable is the drains. And you secure the drains with sutures so they're going to be pulling at the patient's skin. That's where a lot of the pain comes from. But the demanding job, probably 1 week to 2 weeks, and then you can kind of go back to work. I have had some patients with desk jobs that go back to work 2 to 3 days later with the drains, and they tell me they did fine. But anything that's really physical, you probably want to wait about 1 to 2 weeks before going back to work. And then if you're lifting a lot of weight, you have to be careful that when you're lifting the weight, if it's putting too much strain on your muscle here, you want to back off because you don't want to pop the sutures. But yeah, I would say about 1 to 2 weeks, you should be able to go back to pretty much your job, even if it's demanding. And most patients wear a binder to help with a little bit of compression, and then they're able to work and do what they're doing.